How do you train and quality assure clinicians?
Yeah, so we bring in clinicians to train that are MDT trained, and then that's what we require as a basis for starting our training in and of itself. And so we take preferably credentialed clinicians, but as long as you're through Part B and plans to go into the advanced training courses, you can at least get started. But you'll get the most benefit from our training program if you've been through some of those advanced courses and are certified. So once we take, and the reason for that is we all know from an MDT perspective is it's the most reliable musculoskeletal assessment in the literature. And so if we take a reliable assessment and then put them through our training, then we can standardize around that. So then we have a web-based training platform that all of our internal clinicians as well as affiliate clinicians go through, and that involves a series of modules that are built out specifically to standardize the clinical process. And at the end of that, then there's a certification exam. And the idea being there is if you can pass that exam based on the content and your previous clinical training, you now have a base set of knowledge that's standard in our organization. And if we have that base standard knowledge, then we can start to create an assurance around the quality of it. And that's where then we have, outside of the education, but we also have grand rounds, we call it. So that is a kind of, we'll call it data-enabled case management. So on patients that are seen in our system, we keep serial data on them each visit. And based on the metrics that they're reporting to our registry, if they aren't meeting certain benchmarks, they're flagged for what we call grand rounds. And that's a weekly call with certain senior clinicians in our organization where that case is reviewed to make sure that it's being managed properly. Recommendations are made then around clinical management or next steps based on what's being presented. So that's a piece of the quality assurance. We also have what's called all hands grand rounds. It's a monthly educational platform where senior clinicians or Mark Miller usually presents a given clinical topic, and that is a web-based virtual meeting that people can log into each month and hear and be educated around a given topic. So those are the three ways we educate and train, and then and quality assure our clinicians to make sure that we're standard in our approach.